A record number of Americans are without health insurance or cannot access health care. It's a health care crisis like none we've ever seen.
Americans increasingly have problems accessing and affording health care. The reasons are multiple, but many folks live in rural areas and don't really have health care in their county. Many folks work for small businesses that do not offer health care. There are people that at the same time are on public insurance such as Medicaid, and it's not an acceptable payer source. And really you have a lot of people that can't just afford the health care that is offered, but increasingly you have people that have pre-existing medical conditions and they're denied insurance, and because of that can't access or afford health care.
When she went back to school, Tricia Cole became one of the many millions of Americans who lost, cannot afford, or cannot get health insurance.
As an older student going back to school full-time, left a position with health insurance, went into school, and really you have kind of a constant level of anxiety, not sure what's going to happen if you were to get sick, what could happen, just a day-to-day added stress in your life.
Adding to Tricia's anxiety was the discovery that she was pregnant.
My OBGYN was no longer providing obstetric care due to the change in malpractice insurance, and so I had to find a new doctor, and without health insurance it was next to impossible.
Like many Americans in her situation, Tricia turned to a federally qualified health center. These community health centers are managed locally, professionally run, and offer high-quality adult, pediatric, and prenatal primary care. Dental and optical care are often available, all at a discounted rate. Partially funded through government and private grants, community health centers are an indispensable safety net to those with low incomes or without health insurance, and those insured by a federal or state medical insurance plan. But as more people lose their coverage, these centers are feeling the squeeze.
Right now, over 7 out of 10 patients that we see are at the poverty level. These are folks that are vulnerable. These are folks that need quality health care. They have difficulty with affordability. Community health centers are responding in a brick and mortar sense. We have expanded the number of exam rooms. We have built new sites. There are over 7,000 community health center sites. But on top of that, we've modernized our facilities. That's going around the United States. Community health centers are modernizing themselves. We've added an electronic medical record to ensure that our outcomes are excellent and well documented.
Community health centers are an integral part of our healthcare system for over 16 million people nationwide, especially our more vulnerable neighbors.
Legislators and private citizens should be aware that community health centers have a 40-year proud history of respectfully taking care of people. This is a medical model that just plain works. In 2007, the Office of Budget Management gave community health centers their most effective rating. We're cost effective in terms of keeping people healthier, keeping them out of the emergency room, and keeping them from being hospitalized with more complications and early death. Because of this, we should have wide range, and we do have wide range bipartisan appeal from government entities and local individuals because of what we do.
For Tricia, discounted health services were the only way she could get the care she needed.
I honestly don't know where I would have been without the ability to come into this community health center and have care during my prenatal time. Knowing that there were really no other options in my community, it was a very scary thought if I didn't have this access to care. It could have been devastating for not only my life but for my son's.
Crusader Community Health is putting care within reach. With 3 full-service locations in Northern Illinois, Crusader Community Health serves 40,000 patients a year, 17,000 of them children. Focusing on affordable, high-quality adult and pediatric primary health care, along with preventive care, one patient at a time, Crusader Community Health has become an invaluable resource to the low-income and uninsured in Northern Illinois.
Crusader Community Health, one patient at a time, is providing care within reach to the citizens of Northern Illinois. We're responding by offering access to affordable and high-quality health care. Crusader Community Health takes care of the whole patient in a holistic sense. We look after their physical health, we look after their emotional health, and increasingly we're interested in the education of them to make a better person. We offer health education classes, both GED and parenting. We work as a team environment to ensure that we give the most effective and highest quality health care.
Crusader Community Health has staff who care about you. Besides adult and pediatric care, CCH offers women's health and prenatal care in their Modern Women's Center. Crusader's talented and supportive physicians and midwives deliver over 1 in 5 area babies.
The services of OBGYN at Crusader are comparable, if not excelling above the other services here in town. All 3 obstetrician gynecologists at Crusader are board certified in the specialty, and we perform about 1,100 deliveries a year, and we provide a full range of gynecologic services. So we provide excellent obstetrical and gynecological care here.
Crusader also offers optical, podiatry, and dental care. In fact, Crusader Community Health is the largest dental program in the state of Illinois for low-income patients, seeing nearly 10,000 patients a year.
My health insurance went from me having it to not having it due to jobs and income. When I lost the insurance, I was worried about where would I get her vaccine. So when I finally came, we were a couple months behind, but I was relieved that they took us in, no problem. I'm just grateful. I know my family grateful, and I don't believe I'll be sitting here probably without Crusader.
I think that it's really nice here, and that I think it's a good place for you to go to the doctor.
Without having health insurance, number one, I always tried to downplay it. I was self-employed, small family-owned business. I didn't have the capital to get the health insurance, and so I found out about Crusader Community Health, and that's where I started coming, because it's on a sliding scale, and they took me in. Other private physicians would not take me in to treat me, and I knew the exorbitant cost of that, so I was able to come here and get quality care. Back in November of 2002, I had emergency quadruple bypass surgery because they had found that I had 4 arteries 70 to 90% blocked, and of course I did not know that, and without the community health center, I would probably be dead. I would recommend Crusader Community Health on an #1 basis. I know that there's excellent quality medical care. I've been using their services for probably 15 years, and I used to have my children here when they were young, and they're 21 and 22 now.
So many individuals are without health care. It's not a specific segment of the population. You feel like there are no places for you to go. You might go to a traditional office and be treated with a different level of care. And here at Crusader, everyone across the board, with insurance, without, no matter what language you speak and whatever background you come from, you're treated equally and with a great high level of care.
Support Crusader Community Health. Care within reach.
Crusader Community Health will continue to offer care within reach, one patient at a time. We provide health care, both medical and dental, that is accessible, that is affordable, that is patient-centered, that takes care of the whole human being. We will continue to provide this to the citizens of Northern Illinois and ensure that we are an integral part of the healthcare safety net that improves the health of not just our individuals in the community, but the community itself.
For more information about our services, visit crusaderhealth.org. Se habla español.